Stroke is the second most common cause of death worldwide and is a leading cause of permanent disability. Hello, I am Dr. Sandeep Burathoki and I am interventional neuroradiologist. Today we are going to talk about acute stroke, symptoms caused by stroke and its prevention. Stroke is also known as brain attack similar to heart attack. We define stroke as sudden onset of focal neurological deficit, focal loss of brain function due to disruption of blood supply of the brain. And most commonly, stroke happen due to a blood clot blocking the blood supply of the brain. This kind of stroke is known as ischemic stroke. Another form of stroke is when one of the artery in the brain rupture, causing the brain hemorrhage, and this is known as hemorrhagic stroke. It is very important to identify the symptoms of a stroke because it is possible that we can remove this blood clot causing the stroke if the patient arrives to the hospital within the therapeutic window period of 6 hours. To understand more about the stroke and symptoms caused by stroke, let us see this human brain model. So this is the plastic model of human brain, and this brain is divided into left hemisphere and the right hemisphere. And here we could see that each part of the cerebral hemisphere is divided into multiple lobes. The front side is the frontal lobe, behind the frontal lobe is the parietal lobe, and at the end is the occipital lobe, and this part is the temporal lobe. So each part of brain has a different function, and we can imagine this as a cabinets with different things within the cabinets. We could consider the front part of the brain as a CEO of the brain, which plan and execute the motor function. For example, if we want to go for a shopping or we want to cook a meal, frontal lobe will plan and execute the correct order of motor function to achieve that. Behind this area is the motor cortex. So this is the motor cortex, and which controls the motor function of upper and lower limbs, especially the learned skill movements. And behind this motor cortex is the sensory cortex, and this is responsible for the touch sensation. Normally, the right side of the brain controls the left side of the body part, and the language function is exclusively located at the left cerebral hemisphere. So when a clot occludes one of the brain artery, the part of that brain will die within minutes due to lack of oxygen, glucose, and other nutrients. So if the stroke involves the motor cortex on the right side here in this artery, then this part of the brain will die within minutes and will manifest as a loss of motor function and weakness on the left side of the upper limb and lower limb. And these symptoms occur suddenly and involve one side of the body parts. Simplest way to recognize the sign and symptoms of a stroke is to remember the mnemonic B fast. B stands for balance. If someone suddenly feels sudden onset of dizziness, instability, this could be a sign of stroke. Then E stands for eye symptoms. So somebody is feeling a sudden loss of vision loss on one side of the eye, visual blurring, double vision, or as if there is a curtain pulled out in front of one of the eye. Then F stands for face. Ask the patient to smile. If the smile is uneven, if there is a drooling of face on one side of the face, it could be a sign of early stroke. A for arm weakness. Ask the patient to lift both the arms, and if there is drifting of one of the arm, if there is heaviness feeling or weakness on one side of the arm, then this could be a sign of a stroke. S for speech. If there is a speech difficulty, unable to speak or slurring of speech or unable to understand the speech, this could be a sign of stroke. And finally, the T stands for time to call ambulance. So don't wait, don't hesitate, call immediately the ambulance and reach out to the stroke center. Every minute delay causes about 1.9 million neuron loss. So don't delay to reach out to the stroke center. Stroke is preventable condition and is treatable condition. It can be prevented in more than 90% of the patients by adopting the healthy lifestyle. It's very important to know the risk factor for the stroke. The most important risk factor for the stroke is high blood pressure. Other risk factors are diabetes, high cholesterol, smoking, alcohol, obesity, lack of exercise. So it's very important to know all these risk factors and adopt the healthy lifestyle to prevent the stroke from happening. It is recommended to keep the blood pressure below 130 by 80 millimeter mercury. It is recommended to do regular exercise, at least 40 minutes of vigorous exercise 3 to 4 times in a week. It is advised to take a Mediterranean diet rich in fruits and vegetables and dry fruits and olive oil. The consumption of fish at least once in a week reduces the chance of stroke by 50%. It's very important to remember the early signs of a stroke, to remember the mnemonic "be fast" and to adopt the healthy lifestyle.